There's LIS. 1386 is your max that you can make and still get full LIS. Max you can make and still get assistance is at the bottom. We didn't even have that one on here. Income resources. Easiest thing to do is just touch base with me or someone like me and have me look at your situation. I can tell you exactly what level you fall on as far as your eligibility. Where you fall in this chain determines what level of benefits you qualify for, what extra help you qualify for, what programs you qualify for. Part C operates on the same window as everything else except for MedSup. Most things are simple with the same enrollment window, 3 months before, a month of, 3 months after. Most of us in this room are already past that, and so the enrollment window we deal with every year is called the annual enrollment period. That's coming up in October. So there's the pre-annual enrollment period from October 1st to October 14th. That's where someone like myself, I could talk to you about next year's plans. I could not take an application to help you sign up for one, but I could talk to you about them. October 15th through December 7th is the Wild West. Go ahead.
And you're going to be here in November.
I will be doing meetings here, different purposes during that time as well to help you guys with that process as well. But what happens during this is what I call the Wild West. So this is the only multiple election period. So what happens is, let's say Agent A comes over to your house on October 15th and you sign up with Anthem. And then 2 weeks later, Agent John from Humana comes over and says, oh no, that guy doesn't know what you're talking about. You should do this one. And so then you sign up with Humana. And then December 5th comes and another guy from United Healthcare comes over and talks you into switching United Healthcare. Last application in on December 7th at 11:59 p.m. is the one that wins, and that's the one you're going to be on.
That's when you start getting all the property.
All with the mail, the TV, all that stuff becomes very overwhelming and sickening real quick. I know, I'm in it all the time. So it sickens me too because I'm not allowed to say, hey, wait a minute, that's a United Healthcare ad, that's a Humana ad, that's a this ad where they're giving you one very small glimpse into what's available to you. January 1st effective date. So whether you sign up on October 15th or December 7th, any day in between, if you're using the election period AEP, effective date will be January 1st. So this, you're basically choosing what am I going to be on for next year. If you do nothing, you stay on whatever you were on if it still exists. You automatically transition. This year they're bringing back, they used to have what's called OEP, which is Open Enrollment Period. They're bringing it back for 2019. I am allowed to tell you that because it's public knowledge. So there's one small thing I can tell you about next year. But they're going to open up a new enrollment window, Medicare Advantage to Medicare Advantage only. So you can't go from drug card and A and B to an Advantage plan. You can go from United Healthcare to Humana or Kaiser to Aetna, or you can move around. But what will happen is the doctor network changes usually aren't announced until January 1st. And so you'll go through the process, we'll go through, okay, your drugs, your doctors, all that lines up, this is the plan you should be on. And then January 1st you get a letter from your doctor, we're no longer participating in company XYZ. And so that's the spirit of opening this window back up. But it's 3 months, January, February, March. You sign up in January, it'll be effective February 1st. February will be March 1st, so on and so forth through the end of April 1st would be the last effective date. Oh, one other change that's not on there. Anybody that's dual eligible or low income subsidy. Does anybody fit that parameter? Have Medicare, Medicaid? You have the ability to switch plans today, any time of the year. You can change this month, next month, month after that, month after that, all year long if you want to. Next year, they're changing that. Instead of every month, you have once per year that you can do that. Which, there's some good and bad to that. Because I've had it personally happen to me where I go over and help some nice young lady, and then 3 days later, some smooth talking salesman calls her and says, hey, I work with whoever. Oh, Josh? Yeah, I work with Josh. And the next thing I know, someone's over there moving them back to something else they shouldn't be on, and then I have to go back and fix it. And so, for me, there are parts of that rule where they're getting rid of the move anytime that I think there's some positive. But there is some negative too, because the strength of that, and for the rest of this year, the strength is, if you have a new prescription or a new doctor or a new situation come up, you're able to change plans if you need to. So if you need to take a prescription that's not covered, we can move you to a plan that does. And so there's some advantages to that. Is anybody a VA veteran? Okay? There's special programs that are designed for people in that situation. If you are in TRICARE, or when you get to Medicare, it becomes TRICARE for life, I would say 99 out of 100 people that I help in that situation, they're already in the best place they can be. And you can mess up some of the benefits with TRICARE if you go cross the road. Same thing goes for retirement plans. If anyone knows anyone, or if anyone is on any kind of retirement plan, whether it's Para or IBM or Kodak or whoever, I've maybe 1 out of 50 where I compare what you get with retirement plan, what you can get with just Medicare. Medicare wins 49 out of 50 times, just because of the strength. That's what I can tell you with confidence. Once you reach Medicare, you're now getting the best coverage you've ever had in your life for the lowest price you've ever paid. So congratulations, you made it to the line. My dad and millions of other people never made it to 65, and they paid into the pot. And so it's a great program. If you have retirement coverage, which most of you I would guess do not, but if you do, let me know, because you want to really evaluate that. So again, this is my mantra. I believe this with my whole heart. There is no perfect company. There is no perfect plan. There's strengths and weaknesses to each one of these plans out there that are available. What I do is I match you up to the one that fits you best, not the one that fits my needs best, or the insurance company's best, or Andrea likes best, or whatever it is. Because sadly, I would say probably half the time when I help someone, I always ask, how did you end up on the plan that you're on? Oh, I talked to my sister, I talked to my neighbor, I talked to some unqualified person to give me advice. If you had a serious medical condition going on, you wouldn't ask your friend or your neighbor, you'd ask a doctor. And so it's the same kind of thing. Bless all your friends' hearts for those that try to help out and stuff. But in reality, if someone's not doing this all day, every day, and even those that I've trained that do this all day, every day, most of them don't know what they should know to help you. So that's the key thing. Find someone you can trust. Thank you. Hopefully you all learned something today. Again, my presentation is not to tell you you should buy this one, or this one's perfect, or I like this one the best. Yes?
I keep getting emails telling me I'm going to get a new Medicare card.
Yes. Yes, yes.
What do I do?
Sometime between now and April, if everything goes to plan, which is government, but there's 90 million people on Medicare. And so when they thought about this, one, congratulations government, it only took you 53 years to figure out it's a bad idea to put a social security number on a card. But congratulations, they did make the change. So sometime between now and April, you should get a new card, and your current card will be good all the way through the end of next year, just in case. Any other questions?